Hi everybody, my name is Nuala Connolly. I am a researcher in the Child and Family Research Centre, the UNESCO Child and Family Research Centre in NUIG. I am working on the parenting work package. It's part of the research and evaluation programme of the Mainstreaming Development Programme for Prevention, Partnership and Family Support in TUSLA. So I'm the research lead on the parenting support and parental participation work package. As you might have met Anne Cassidy earlier on, she's leading on the MEHAL work package, and Fergal Landy, who used to be in the centre, is now working with TUSLA. So I'm going to talk to you a little bit today about, one of the activities I've been working on. So as part of the parenting, the research and evaluation of the parenting support and parental participation work stream within TUSLA, we've been undertaking a number of activities. A couple of the activities relate to parenting support, and a couple of them relate more closely to parental participation. I should also mention that the participation of children is an entirely separate work package and has its own lead researcher. So a couple of the activities I've been working on is reviewing the literature and learning what I can about parental participation in family support and also in the child protection context. And in addition to that, I've been working on a couple of baseline studies, one of them on parenting support services in Ireland and one of them on parental participation in an Irish context, and that's fairly early days now. But what we know is that there aren't as many formal structures as there are for children's participation. So what I'm going to do is talk a little bit about the parent voice and family support. So looking a bit at the policy context and the opportunities and challenges to have the parent's voice heard in a family support context. And then what I'll do is I'll talk a little bit about what TUSLA are doing specifically around parental participation. And I will show you some of the contents of their parental participation toolkit. So they have a parental participation project as part of their overall parenting strategy. And as part of that project, they're developing a toolkit, and there will be a series of briefings around the toolkit. And I'll just show you a little bit about what's in that as well and what form that's going to take. Okay, so just to give you an overview of what I'm going to talk about. So it'll be a little bit on the policy context. Definitions of parental participation, we hear all these key words: empowerment, engagement, co-production all the time. So just a little bit about tightening that up and thinking about how it's been defined in terms of the Child and Family Agency and what will that mean in terms of how services are rolled out. Looking at what's key actually to parental participation, what parents want. There's a lot of service perspectives on it, but actually asking parents what they want. How involved do they actually want to be, which is an important question sometimes. And sometimes also there's the question of how involved they can be if it's particularly in a child protection setting. And then just looking at barriers to participation, so that again from the service point of view and from the user's point of view, what are these barriers and potentially how can they be overcome? Looking also at parents in different contexts, so just the changing, I suppose, face of family structure in Ireland and what that means for how parents can be supported. And then also a little bit on enabling parent participation, and some of this is just, I suppose, common sense messages, but that are borne out in the research and the evidence and the literature. And then TUSLA's approach to parental participation, and I'll show you a bit of what's in the toolkit. So to start with, why parental participation? There's a lot of literature, lots of studies, a lot of them coming to the same kind of common sense conclusions, and it's become more of a policy imperative in the last few years, and I'll show you a little bit about that as well. Generally speaking, there is this desire to enable users to exert an influence over the services they receive. And this is in part, I suppose, about recognising parents as having a right to participate in decisions affecting their families, and also just contributing to better outcomes for their children. So that's the general consensus, that they'll be able to exert an influence over the services they receive. And that could be from design right the way through to service delivery to evaluation and monitoring. There's a general consensus as well, or a belief that the involvement of service users in decisions made about provision of services is a more ethical and a more sort of effective way of proceeding. It's also been found that it can be an effective means of reducing barriers to engagement, that if more actions are taken, particularly on the consultative end, to try and engage parents, it can advance social inclusion. And also just this sort of shift as seeing people as sort of passive beneficiaries of welfare who need to be sort of activated to realise goals set by service providers, to actually emphasise their capacity as service users to be creative and reflexive agents in shaping their own lives. And then I suppose an important point as well would be that the translating the ideals of participation into reality can be challenging. We know there are lots of barriers, and some of those are particular to child protection type settings too, where there's obviously a power asymmetry in place, and it can be difficult to realise some of the goals. So I'll mention that too. I don't want to talk too much about the policy context, but I think in a child protection setting it was born out of some child abuse cases. I think the Kilkenny incest investigation, there was a which was in the late 80s, a Roscommon child abuse investigation more recently, and there were laws and responses to that, more recently, in terms of it being a policy imperative, we're seeing more in relation to TUSLA, in relation to the DCYA, as looking at parental participation as a policy imperative, and the HSE as well. So more recently, the 2007 Your Service, Your Say, Comments, Compliments and Complaints policy was introduced to encourage people to have a say. The national strategy then for service user involvement in the Irish Health Service as well, and they would define a service user as a patient, a carer, a parent and a guardian. So that was one where parental participation was acknowledged too. More recently as well, the high-level policy statement, that's from this year, on parenting support, which realises a commitment of the Better Outcomes, Brighter Futures, the policy framework for children and young people, and it also flows from a remit given to TUSLA under the Child and Family Agency Act 2013, and that also emphasises partnership, and that's another word, as I mentioned, engagement, partnership, participation, co-production, all these terms we hear a lot interchangeably around the participation of parents and sometimes young people too. So that emphasises partnership with children and their parents. And then the Child and Family Agency Act 2013. So that has set the ball rolling on a range of activities around children's participation and around parental participation. The idea is that the participation of children and parents is embedded in TUSLA's culture and operations, and they have engaged in a programme of work around that. MEHL, for example, and I know if you were here earlier on for Anne and Fergal's talk, you would have learned a bit about MEHL and how MEHL operates too, in support of parental participation. And it's the idea is that it privileges the voices of the parent, carer and the child, and it recognises them as experts in their own situations. So the idea is to bring everyone around the table and hear the voice of everybody at the table. So that's a sort of process moving in that direction. In terms of the parenting support strategy, yeah, there is, it outlines the agency's activities and around parenting, and there are a range of activities around parenting support, and I'll talk to you about that. It's things around the development of parent support champions and a parent support champions network, but also in terms of parental participation, there is a parental participation project taking place, and that encompasses a seed fund that's likely to be rolled out, and also the development of a toolkit and associated briefings. And then finally, TUSLA's quality assurance framework includes a range of sort of aspirations around the development of services, and these include that children and families are integral to communities, and that they should be consultant in decisions that affect them. So let's just give you a sense of where it's come from. I mentioned some of these sort of key words that you hear all the time, and defining parental participation, it's not as clear-cut. There have been a lot of efforts to define children's participation quite clearly in the literature. Parental participation is something that's a little newer, and we're starting to learn more about that, and we hear a lot of key words around the engagement of parents, that ideally participation should empower parents, the co-production in how services are delivered, of how decisions are made. We hear participation, obviously partnership and partnership working, and involvement, just involving parents. And there are a range of different definitions. In terms of the Child and Family Agency, the definition that they provide, there are two. So there's participation and partnership. And the idea is that partnership between service providers and families is the act of them working together for the benefit of children, and that participation is sort of key to achieving that partnership. So participation is the involvement of service users in the planning, delivery and evaluation of parenting support, and I've highlighted delivery just because I'm intending to focus on that a little bit. So it's the involvement of service users right the way through the life cycle of delivery. So it's right from planning, so consultation around planning, delivery, how services are delivered, and delivery within services and how practitioners can work in a participatory way. and the evaluation also of parenting support, so they should be included in how things are evaluated and when they're evaluated. And then the idea of partnership, working in partnership with all stakeholders, particularly parents, in relation to the development, delivery, monitoring and evaluation of parenting support services. So it's the two definitions they're working with, and you can see they're quite similar. And as I mentioned, the idea is that parents can be included at a number of levels. And this we see, and we see some examples of this in practice, and sometimes, you know, pockets of good practice in terms of one level and not another. The ideal is that parents will be included at all levels, but it's not always practical, and there are various challenges from a service point of view to realising this. So decision making within service delivery, and that's again one that's can be difficult in say a child protection or a statutory context. But the option that the parent can be included in some way in the process, involvement in case planning, involvement in service evaluation, monitoring, service planning, and strategic planning. So right the way through that the parent would have a voice. Okay, this is Arnstein's ladder of citizen participation. So this is often used as a sort of conceptual theoretical model of what participation should look like and what meaningful participation should look like. And there are various critiques of it, and it's actually, this one is kind of, there's a focus on power. So the idea is that citizen participation equals citizen power, and we know that that's a bit of a challenge sometimes in family services, but nonetheless it sort of has some useful points. So at the bottom there's this idea that therapy, manipulation, anything that's activating the parent specifically to realise a goal set by the service provider without asking their opinion or without acknowledging their competencies, in a way is an act of sort of non-participation really. And then there, interestingly, and something that sometimes what people would naturally think is the obvious choice for having a parent participate, the bit about informing and consultation is listed in this model as the kind of third, fourth and fifth, and the fifth one, placation, is more around where you might have a parent sit on a board or sit on a group with almost a view to educating them and coercing them to a point of view, but not actually giving them any power in the making of decisions. But these three are considered to be almost forms of tokenism, in that the voice is heard, but there isn't always, the voice doesn't always translate into the decision. So the voice might be heard, but the parent may not have a real say in what decisions are made or how they're made. So that's why they're sometimes flagged as sort of tokenistic. Now, in saying that, there are a lot of really good opportunities for consultation, and it's really important to consult parents if it's done in the right way and if it's at some point used, but just to be mindful of that. And then the idea that citizen power, so it's that bit about partnership, and I think that ties in as well to the kind of the relationship building bit, which seems to be a common theme of a lot of the presentations. So working in partnership is key in terms of parental participation to achieving real and meaningful participation. Now, there's some critiques of that and alternative views, and it is important to note that it's not an all-encompassing model. It's just sort of a useful guide. I think it does have a sole emphasis on power, and I would agree with that. And it does fail to recognise that participation itself may be a goal. So sometimes the goal isn't that the parent will necessarily be fully involved in the decision making. It's just that they're there and they're able to participate and that they feel that their voice is heard, and that ties into what the parent wants sometimes from the setting too. And I think sometimes as well that non-participatory acts can be deemed as meaningful to the overall process, and that in itself can be an opportunity for learning. So partnership working with parents, where the parent doesn't always participate, can still be quite important in learning and in learning about that relationship and in learning how to improve it. And then also there's the idea that sometimes this undesirable behaviour of parents can be interpreted as problematic. So where the parent fails to engage, then that can be interpreted as problematic, and that might reduce the partnership to this kind of protectionist approach that we talked about, or that I talked about, where you're activating these kind of parents to realise goals that are set. So it's to be mindful of some of the contradictions that are there too. So I just want to talk to you about some of the barriers to participation, and some of these are kind of common sense messages, but they're coming from the literature. They're evidence-based messages, so they're worth noting. And a lot of this, as well as it would have come out of the literature, would have informed some of the toothless activities around parenting support and parental participation. And some that we know of as well: perceived stigma in accessing services, and one that's a real challenge to overcome. And that's a natural barrier to parents even just participating with and engaging with services in the first instance. unfamiliarity with the language, unfamiliarity with the process mechanisms and settings. That's one in studies that comes up quite often, actually, and it's one that sort of it's repeated a lot in a variety of different studies, in a variety of different contexts. It's the unfamiliarity with the language, the terminology, sometimes more, again, the more formal statutory settings, but in a lot of settings, it's that feeling a bit sort of like the other in the space rather than someone who's included. And it can be just the mechanisms, the language, and some things that come naturally to people working in the environment, but not to the parents. Something as simple as feeling outnumbered comes up too as something that parents are concerned about. One a lot is around participating to a peer cooperative. So that point at which the parent is saying what they think they want the service provider, or what the service provider wants to hear, or what they think they want to hear to get the right outcome. And there's a piece there around relationship building and being mindful of that, and probably an opportunity for training around that too. And then sometimes that parents feeling ignored, or that their views might be disqualified or even used against them, which was mentioned in the previous presentation, and that they might feel silenced or powerless because of it. They don't want to speak up because they're afraid of what will happen with the information that they provide. So those were some of the barriers to participation that came from service users. And I mean, it's both sides. There are a lot of barriers to services working in a participatory way too, and that's important to acknowledge. And it's some of them it's an ongoing challenge to overcome them. So understanding how parents seek help, and that's something. Informal support is obviously hugely important to a lot of parents, and how they seek help around their parenting. And we're actually, as part of one of the other work streams, so as I mentioned, I'm on parenting support and parental participation. Professor Caroline McGregor, who was named in the previous presentation but couldn't be here today, is leading on the public awareness research and evaluation work package. And she's doing they're working on a population survey around education and awareness of various different parts of TUSLA's programme, and one of the questions they've been asking people on the doorstep is about where and how they seek help. So it'll be interesting to see what findings come from that, and I suspect once we start to go through the analysis, it'll be that a lot of people find informal support is a really important source of help, and just understanding that too. Working with hard to reach service users, working with hard to reach service users, important, and that's an obvious barrier, and that's an ongoing challenge for everybody to overcome. Training in tools, something is identified as important to working in a participatory way. That comes up quite a lot in the evidence base as well, that there is an appetite out there for training around this, and for even training in terms of a set of principles to work in this way, or the skills to work in a participatory way, and that focus on relationship building. Resource limitation or restrictions and workload, that comes up a lot. People don't necessarily feel they might have the time to run a suite of focus groups with parents and analyse the data, or do, say, a community profile, because it might feed into the types of services they provide. So that can be a natural challenge too. Access and geographic location, where they're located, how they can access the parents in the local community. False level of quality came up sometimes in the research, so it was about where there was a definite interest in working in that way, and a discussion of how it was realised, but actually from observation in practice things were happening slightly differently, and sometimes there were slight power imbalances from observation studies of how service providers were interacting with parents. And then, the obvious bit again about working with involuntary clients, that sort of challenge as well, and the statutory responsibility and just the power asymmetry in the room when the social worker in the child protection context is trying to engage the parent to work in a participatory way, and there are a lot of difficulties around that. So, and I mentioned earlier, key, I suppose, to making decisions around this is what parents want. And there's been a lot of research into what parents want from services, and a small amount of research into what they want in terms of parental participation. And again, it's the common sense messages. And a lot of them may exist in practice too, and may be practiced. And hopefully, when I get an opportunity to finish the parental participation baseline, we'll know more about how that happens. And I know there aren't a huge amount of formal structures for that in place, or for parental participation in place in Ireland, but we'll find out what's there. Having a voice is linked to satisfaction and with decision making, so it's being treated with respect and having a voice. And having a voice from parents' point of view, a lot of the time actually involved being asked for their opinion. So not just being present and being included, but being repeatedly asked, do you agree with that? How do you feel about that? And that sort of simple tool. Parents are more likely to exercise their voices when their opinions are asked for and where there is willing and supportive communication. So that was key. And then there's that practitioner working in a participatory way. So the practitioner using that sort of set of principles about making sure the person feels engaged in any relationship, and that relationship building. And parents found that they were more likely to be engaged and felt that they'd participated more when they were, say, working regularly with the same practitioner versus, meeting somebody different each time. And then experiencing teamwork and flexibility on the part of services too. So key was really the bit about having a voice, being asked for their opinion and simply being treated with respect, and feeling that parental competencies were acknowledged and that the services were working in a strengths-based way. So the bit around feeling that their competencies were acknowledged, and it was that the focus was on their strengths and not on their limitations or any challenges or obstacles that needed to be overcome. So we know that there is a changing profile of families in Ireland. The number of children in families has increased, deprivation rates are rising, the number of lone parents is rising. Those living in households with one adult and one or more children actually have the highest deprivation rates of all. We know that our ethnic profile is more diverse. We know that there are increasing number of residents born outside Ireland. And we know for a lot of residents born outside Ireland, a language other than English is spoken in the home, and of those who are speaking a language other than English in the home, in the last census, 90,000 said that they didn't speak English well at all. So we know that there's some interesting information out there in terms of the profiles of families, and I know community profiling comes up a bit in TUSLA's parental participation toolkit, and you can kind of see the value of that when you learn a little bit about that. So there's a changing profile of families. There are parents with specific needs. The literature says that mainstream services could do more to engage fathers. This came from a few studies where fathers felt that they were treated differently. They were reluctant to engage with services because they felt they were going to be treated differently. In saying that, there isn't consensus around whether there should be gender-specific services, but there was general consensus that training in this regard, to be more gender sensitive maybe in terms of service delivery, would be beneficial. Cultural barriers, as sometimes separate from language barriers. So cultural barriers may impact on the uptake of programmes, and that's something where community profiling can come in too. And I know the CIPSEs do community profiles of areas, or do sort of CIPSE area profiles, which can be quite helpful to getting a sense of what the area looks like. And they may impact on the uptake of programmes reflecting different cultural attitudes to parent or to parenting, or just lack of awareness sometimes as well. And hopefully our public education survey, our public awareness survey, will tell us a bit about that. Language barriers may impact on the uptake of services too. Parents living in poverty, and I haven't listed everything here. I don't think I've put lone parents here. Parents or one-parent families. Parents living with a disability might require additional supports. We know this. Involuntary clients will require a different approach in terms of how participatory practice operates, and where there's specific maltreatments that might need to be recognised too, and that domestic violence situations require a different approach too. So we know that it's a real challenge because there's no one size fits all for this, and that's part of the challenge, I suppose, is trying to how to ensure that all parents are included and all parents are engaged and feel that they're participating in a meaningful way in services that are provided to them. So in terms of enabling participation, there are a few sort of principles that come out of the literature, and after this I'll show you some of what TUSLA are doing. Ensuring services are culturally sensitive, and some of this obviously in principle is easy to say but much harder to realise in practice, and will take a bit of time. Ensuring services are culturally sensitive and the needs of all parents are considered in service planning, service design and the delivery of services. So in service planning it could be in the form of this profiling, area profiling, community profiling, talking to parents, asking them what they want. That consultation piece is quite important in service planning. But then through to the service design, and that's probably consultation too, but in the delivery of services that's more about those relationships and working in a participatory way. And then there's simple things that parents felt were important. Ensuring the environment was appropriate, comfortable, accessible. ensuring that the purpose of the meeting is clear and that all the necessary information is shared in advance, including a written agenda and information on the roles of those present. And that's again a simple sort of principle that everybody knows what's happening if they turn up to a meeting or if they're turning up to talk about what's available to them. And there aren't a lot of structures around this. Fergal actually was describing to me one example of a parental advocacy project in the Midwest as one example of one such structure where any parents, and this is particularly in a statutory context, where parents actually have an advocate, and one of the roles of the advocate, and this is coming from a legacy piece, and one of the roles of the advocate is to do this sort of thing, so to make sure that the parent knows what to expect in any meeting, and the advocate can go with the parent if they have to go to court or something like that. So that's one sort of example, and that's here just in the Midwest. But in the UK, it's something that's been nationally rolled out, these kind of advocacy projects, they call them, where parents in those particular settings who have more complex needs have these advocates. So maybe that's something we can consider here. So ensuring that's all clear. And then it's that strengths-based approach and focusing on their competencies. So parents felt sometimes that wasn't what was happening. And then actively encouraging their views by seeking their views, so asking parents for their views repeatedly through a process, following up on any plans or decisions rather than letting things slide, so going back and repeating with parents what had been decided and what had been agreed upon and whether it had been realised. And then that bit about relationships is key too, so the interpersonal dynamics, trust, authority, handling negotiations and attitudes. And this is something, again, where there's an appetite for training around this for people to work in this way. And then also the final piece, I suppose, in rounding the circle in participation for the practitioner is that bit about reflecting on participatory practice and feeding back in. So what have you learned from working in this way, and what does it mean for how you deliver your services? And then promoting that joined up working, that broader piece then of making sure that that's something that's also an interagency piece, working with all the sector in general and working in a collaborative way to help participatory practice. So that's a lot of the kind of key messages from the research and the literature around parental participation. Just to talk to you a little bit now about what TUSLA are doing in relation to this, and I know I've mentioned some of it as I've been going along. They have a parenting support strategy, and that's divided into sort of parenting support, parental participation. I think alternative care also sort of falls under the remit of parenting too. But for the most part, what I'll be looking at here is the parenting support and the parental participation. So within their parenting support, they have a parenting working group and subgroups. So they have a parenting working group of a set of key people who help to operationalise some of the decisions around parenting. And they've subgroups in relation to that too. You might be familiar with the 50 key messages and the parenting 24/7. I think I have a slide on that. So that's the parenting 24/7. That's the information end of things. So it's part of the parenting support piece, I guess, but on the ladder of participation, providing information is one of the rungs of participatory practice, and they do that. So they have these key messages from the research about how to support children. So they call it 24/7. There's 50 key messages, and 31 of them are aimed at parents across the life course. And the remaining 19 are aimed at parents in different contexts, so that sort of special group of parents. And of the 31, I think that's where the 24/7 came from, because 24/7 adds up to 31, but don't quote me on that. So that's how they've designed the structure of it. They're also rolling out a parent support champions network. So they're going to advertise for parent support champions and find people who can champion parenting support in their areas, and they'll be people from practice who are working in that area. They're also, and this is part of the parenting support, they're also having 3 annual parenting conferences. The first one is going to be on the 8th of December, and the theme of that is roughly around parental participation, and that's going to happen in Dublin Castle. And see, I've highlighted just parental participation just to flag that that's what the focus is here. The parental participation project then is part of that overall parenting support strategy. Yeah, so that's some of the kind of parenting support stuff. In terms of the parental participation, this is just some of the methods they're considering as part of the strategy, and you can see the level of involvement. So they have like the information, the consultation, and then the actual participation in service delivery. So from information, it's kind of how they provide information. Here's what we're going to do. In terms of consultation, it's these surveys, these meetings, things like the MEHL process, the social work process. Here are your options, what do you think? And in terms of then the participation as well, and I think the processes can also fall into this one, that partnership building piece, the mental health process, the social work process, and also the feedback and complaints mechanisms. So we want to make decisions together. So it's that piece from providing information to actively including the parent in the decision-making process. So in terms of the parental participation activities, there were some workshops held with parents around what they want in terms of parental participation. I think there was one in each of the 4 kind of broad areas, and it was designed to be representative. And they've held focus groups with parents. They've had some consultation workshops with practitioners too around the participation toolkit. And those have been ongoing. There are parental participation project briefings happening. And you may hear about some of those. There's going to be seed funding too around parental participation, spread out over a couple of years, and that's all actually in the planning stage. So at the moment, they're considering criteria for funding and considering the application process around that too. So that's ongoing at the moment, all of that activity. So yeah, they use a model for enabling parental participation, and it's this kind of cycle where it's facilitated, it's about listening, it's about actions where appropriate, it's about identifying and enabling. So it's like a life cycle process, and part of the process, it goes from the practitioner working in a participatory way to reflecting on practices also. So I'll just show you briefly some of what the toolkit looks like. It's the last version I have is in draft form, and I think it's been finalised, or if not finalised at the moment, so this is pretty close to it. So just to give you a sense of what it looks like, some of the messages will be similar to what I've talked about here today. So there's a guide on how to use the toolkit, and this will be available to practitioners. There's a bit about the prevention, partnership and family support programme itself. There's a bit about the My World Triangle and how that feeds in, and the parenting support strategy and how it all ties together, and where parental participation sits in the overall parenting support strategy. And then there's a closer look at parental participation. So the definitions, defining what it means, why it's important and why it's important for the agency, the principles of parental participation, how it can potentially be enabled, and parental participation in TUSLA, so what's happening in TUSLA in relation to that. So kind of helpful background and descriptive piece to the toolkit. And then there's the actual tools for parental participation. So they're providing kind of a suite of tools. Now, the tools are largely consultation type tools and evaluation type tools. So there's focus on that end in that particular section, and I'll show you what they look like. And then there's sort of a guide as to how to potentially implement the tools, and a checklist for parental participation just to see where they fit in terms of the information, the consultation and the participation. So that works as section 3. And then section 4 is more about participation in practice, and that practitioner piece about working in a participatory way and in a meaningful way. And that's about the reflective practitioner, working in partnership with parents and the key research messages, and that's some of what I've talked about here. So there's a set of principles there around enabling parental participation in practice and what works to encourage parents to participate and to ensure that their voice is heard in practice. There's a bit about working with hard to reach parents. There's references to further literature, further places you can look for resources and information. And then there's a piece on working with involuntary clients and when engagement is not voluntary. So it's a broad enough scope because it covers family support right through to the core in a more statutory context, but it has some useful tools. So I talk a little bit about some of the consultation tools, and there's a suite of these tools provided as part of the toolkit, and it just gives examples of how they could be rolled out, how they could potentially work, what they mean for parents. So some of it would be local area surveying, for example, doing surveys, parent satisfaction with services questionnaires, how to get parents' views. It could be things like focus groups, I think, are part of it too. I'm not sure they're there. And then also things like community profiling, and there's a mention of the CIPSEs there. The CIPSEs, the Children and Young Person Services Committees, do audits of services in their areas, and part of that is profiling each area, and some of those profiles can be quite useful in sort of providing that type of information. So that's an example of some of the tools they're provided for parental participation. There's also some of the key research messages around what parents want, and this is just sort of one page, but there's a few pages of this, and there's a list of principles around enabling parental participation and what that might look like, and it just talks a bit about understanding about what parents want, what the barriers to participation might be and what they look like and how they could potentially be overcome. There's a bit about working with hard to reach parents, and right the way through there's a talk about the relevant processes. So there's a little bit of a description about how MEHL works to engage parents and children and young people, and also there's links to various TUSLA resources that directly relate. So here they're linking to the 50 key messages, and as I said, 19 of those messages relate to parenting in different contexts. So there's that connection there too. And then that's the last one. That was just a French poster that I just wanted to throw up as a closing quote. It was about, I suppose, the direct translation is I participate, you participate, he participates, we participate, they participate, and they profit. So the idea that for participation, I suppose, to be meaningful, everyone has to profit from it, including the parent. And the parent voice is only important if it feeds back into how the service is delivered to the parent and what they receive and the outcomes for them and their family. Okay, thank you.